Well, firstly, good afternoon, everyone. Let me just introduce myself. My name is Bayo Awesu, and I'm the Senior Recruitment Manager at Bellerbys College. Just firstly, a big thank you for all of you for taking the time to come and listen to us talk today about preparation for entry into medical school in the UK. Okay, what I want to just start off by saying, just to give you a bit of an introduction, is that medical school in the UK is incredibly competitive. It's a very, very competitive subject area to go into, but also it's incredibly rewarding. So the amount of effort and the amount of extra studying and the amount of extra years that you spend studying will totally be worth it for the kind of career that you could have in medicine. So what I hope to do today is convince you guys that it's a fantastic career to go into, but to also give you some insights as to what you need to be doing, what you need to prepare to do to have a future and have a career in medical school within the UK. So what I want to talk about today, just to go over the contents of the session, I'm just going to start off with an introduction about studying medicine in the UK. I'm then going to talk a little bit about medical degree programs, how you actually gain admission. I'm then going to talk very specifically about the A-level program, because that's the core program that you would need to do in the UK to get into medical school. I'm then going to talk a little bit about preparation groups, because these are very, very important as part of your A-level program to make sure you have the best opportunity. I'm then going to talk about aptitude tests. These are extracurricular tests that you need to do, and then just go over some other areas of the process, such as personal statements, the pre-arrival interview, the application process, and also other alternatives, so different plan Bs that you can go on if you don't get into medical school the first time. So first off, in order to actually become a practicing doctor in the UK, you need to obtain a qualification which is called the MBBS, which is a Bachelor of Medicine or a Bachelor of Surgery. Those are the two types of qualifications, but students only need to receive one degree. That's the MBBS. So what you may notice if you start looking at different university applications and different degrees in medicine, there may be some different variations, some different abbreviations. For example, Warwick and Sheffield and Lancaster actually call the MBBS the MBCHB. Oxford calls it the BMBCH, but it is the same degree, so it's the same program. So don't worry if you're applying to a medical degree and you don't see MBBS, you see BMBCH or MBCHB. It is all the same qualification. So you have around 30 universities in the UK that actually offer medicine, but as I mentioned at the start, spaces are very, very limited. It's an incredibly competitive program. With most other subject areas, you can get good grades. You can maybe perform okay, you can perform quite well, and there will be some university in the UK, as long as you pass the program, that will take you onto their degree subject. Medicine simply isn't like that. You really have to be a top student from the start, and you have to have lots of extracurricular experience and activities going on in your CV to give yourself a good chance. And I'll touch on those in a second. And just a final element is that medicine is also quite expensive. If you look at the fact that normally a degree is 3 years, a medical degree is 5 years. So that's 2 extra years of study before you can actually be qualified to have your MBBS qualification. So what would the actual degree look like? What would your actual journey look like from actually studying a degree in medicine to becoming a doctor and to specialising in a particular subject area or a particular discipline as a doctor? So as I mentioned, the MBBS is a 5-year program, and normally the first 2 years of that will be what we call preclinical. So that's time spent learning about the theory, learning more about the human body, biology, chemistry, to give you that underpinned knowledge before you then go on to actually being in a practical environment. The 3 years after that would be spent mainly in hospital wards. So as I say, it would be in a clinical, practical environment, putting the theory that you've learnt in the first 2 years into practice in the final 3 years of your degree. So after your 5 years, you've now got your qualification, you're qualified as an actual doctor, but after actually gaining your MBBS, you still have to work for 2 more years as a junior doctor before you can actually be licensed. So normally these 2 years are spent again working in a hospital, but yet you would split your time in different departments just to make sure you have a holistic understanding of what it would be like to be a doctor. You'll normally do 4 6-month placements in a hospital, just understanding exactly what life is like to be a doctor. So you do that for 2 years after completing your degree. Okay, so after these 2 years, you now are officially a doctor. You're now a member of what we call the GMC, which is the General Medical Council. And this is the time when things start to get interesting. This is when you start to specialize and start to realize what kind of doctor that you want to be. So to be a general practitioner, a GP, which is somebody that you maybe go to if your arm hurts or your back hurts, that would maybe require an extra 3 years training to specialize in that area. If you wanted to move into another field, a very, very complex field of medicine, such as neurosurgery, you may be looking at another 7 years of study. So if you add up the total time that you're spending after you've actually completed your A-levels, you've got 5 years at medical school, you've got another 2 years as a junior doctor, and then maybe another 7 years to actually be a fully respected, qualified neurosurgeon. So that could be up to 14 years of training to really be a true expert in the medical field. So that just gives you an idea of the level of commitment that you need to undertake if you do want to have a career in medicine. So providing that all sounds good, providing you're not put off by the prospect of spending maybe 10, 12, 14 years actually studying to be a real expert in the field of medicine, what do you need to do to get to that position? What happens after you leave high school to actually go on to become a doctor in the UK or anywhere else in the world? Well, what I'm here to talk about today is A-levels. At Bellerbys College or anywhere, I think most people will say that A-levels are the best process if you do go into UK education to study medicine. There are some foundations that offer a route into medicine, but they're very, very risky. We would always recommend to all of our students, if they do want to go into medical school, that they should do A-levels. Okay, so in terms of which A-levels you should be doing, you would typically do 4 A-levels. Some students think that, oh, if I do more A-levels, I have a better chance at going into medical school. I should do 6, I should do 7. We wouldn't encourage that. I wouldn't encourage a student to do that. The reason for that is that you just burn yourself out, and universities don't actually like that. They want to make sure that the students are spending more time really focusing on the best, most appropriate A-levels before they move into their actual medical career. So the actual A-levels that you would typically do, would be biology and chemistry, and then you would also pick physics or maths. It may actually be appropriate to not do physics. Physics is a very good enabling subject, but it's not essential for medicine. It just looks very good that you've actually taken what is viewed as a very hard science subject. But the core subjects would be chemistry and biology. And we also like to recommend that students do a subject that's away from sciences, so something like psychology, something like economics. And the reason that we say this is because, again, it looks very good to a university to show that you have a broad understanding. Your mind is not just 100% focused on science. You understand psychology, you understand modern languages, so you maybe have the broader kind of personality which is going to be suitable to study medicine in the UK. So, and in terms of what you would need to have as your qualifications before you actually started A-level, normally for us we can be a little bit more flexible at accepting students into our A-level program, except for medicine. If you really, really do want to have a career in medicine, you have to be a top student even in high school. So here we've got good GCSE results. But in the case of high school here in Ukraine, I think your grading system goes up to 12, is that correct? So you'd be looking at having pretty much 12 in every subject area. You really have to be such a top student. And the reason you have to be a top student is because even if you get really good grades on your A-levels, medicine is so competitive that it can often be a case where a medical school will have 2 places, or 1 place rather, and they have 2 students who both have top grades for A-level. How do they decide who to take on the place? They go for the student that had great grades back in high school. So your high school grades are just as important as your A-level grades. So you really need to start working very hard now, even at a young age, if you want to have a chance at going into medicine. And you also have to have a very high IELTS score. So you would need to be an IELTS score of 7 or 7.5, 7 at a minimum, to actually go into medical school after A-level. And just finally, and I'll touch on this in a bit more detail in the next slide, but you would need to have some prior work experience in a hospital, a clinical or care home. You would need to have a good score in what we call the UK CAT and the BMAT exams. These are your aptitude tests, which I'll touch on in a second. You would need to have a very strong personal statement. You would need to have an academic reference, and you would need to perform very well in an interview. Okay, I'm going to skip past these slides here. This gives just a bit more detail about the A-level structure. But yes, what I want to talk about specifically is the kind of extra work, the kind of extra preparation that you would need to do to get into a medical degree. This is what we would do at Bellerbys, but in general, no matter what A-level subjects that you, or A-level institution that you select, you would need to think about this kind of extracurricular activity. So the first thing would be having speakers, speaking to people that are actually lecturers in medicine, understanding what it's like to actually be in a medical school. You would need to be involved in a medical preparation group that shares sessions, so you're speaking to students that have actually come through the process and have gone on to medical school. It would be very important that whichever A-level program you do gives you guidance as far as writing the personal statement. You'd be expected to read medical journals, to really start to think a little bit about what area of medicine you want to go into. Think specifically about what kind of career, whether it's being a GP, a neurosurgeon, a gynecologist. Start to think about that. You'd also need to be confident to be able to debate issues of practice within medicine. That's going to be very important for your interview. And also just have interview practice. So just do lots and lots of practicing for the actual medical interview. So you're confident, you're articulate, you know exactly what you want to say in your interview. And then just specific training for the UK CAT and the BMAT test, the aptitude test as well, would be very important. And just finally, I want to talk just a little bit more about these exams here, the UK CAT and the BMAT exams. These are aptitude tests, as I mentioned, and the idea behind them is that they're not like your standard exam, where you would be assessed on your ability to understand chemistry or biology or physics. It really assesses your cognitive thinking. It assesses your ability to cope with stressful situations, your ethics, how you understand ethics and social interactions, because these kind of attributes are very, very important for being a doctor. There's no specific way that you can really prepare for these exams. So really what we do is we at Bellerbys, we expose students to the kind of atmosphere, and we ask them the kind of questions that get them thinking in this kind of way. So that's one of the important things that you would need to do, regardless of the A-level program that you do, is to make sure that you prepare for these exams, because they are very important in assessing your aptitude and your suitability to actually be a doctor and to study medicine. So that just gives just a little bit more detail about what I was talking about. So the cognitive ability is verbal reasoning, qualitative reasoning, abstract reasoning, decision analysis, situation judgment test. So it's basically just assessing all of these kind of attributes that you have to make sure that you're suitable to be a doctor. And you can actually see some specimen tests available on this website, just to give you an idea what to expect, so I can make sure I share them with you. And just to give you some more information, Oxford, Cambridge, Imperial, UCL, Bristol, they require the BMAT, pen and paper test, which needs to be taken in November. So if you're starting A-levels in September, that needs to be taken very quickly in your A-level term. So I just want to just talk quite briefly about the personal statement as well, just to give you an idea as to what a good personal statement would look like, because that's another very important aspect of your medical school application. So the statement should be structured properly, and it should have this kind of structure. So you should start off with an introduction. You need to talk about why you want to be a doctor. It doesn't have to be the most original reason in the world, but it has to be an honest reason why you really want to be a doctor. You would then need to talk about your work experience, and this is why work experience is such an important process, an important part of your A-level study. So it's great if you can talk about if you maybe arranged it yourself. If you haven't, then that's fine, but just talk about what you learnt from being a doctor, being in that environment. Talk about some of the skills that you obtained, some of the experiences that you had, unique examples is always very, very important when going into work experience. And then it's also good to talk about yourself. Talk about some of the extracurricular interests that you have. When you're applying to a medical school, they want to know that you're a real person, not just a set of grades on the screen. So talk about, sports teams that you've been a part of, any kind of musical capacity you have, any instruments that you play, any other awards. So you're really looking to demonstrate that you have good communication skills, you have maybe good leadership qualities, you have, strong interests in things that are just outside the classroom. So they want to feel like they know you as a person, as a human being. And then just finally, it's also a good idea to talk about individual subjects that you're studying and what medicine really means to you, why it is that you really, really want to be a doctor. This links into your introduction. Also, it's also important to show that you've read these medical journals and you're actually aware of the current affairs relating to medicine in the world. So it's also good to talk about things that you've recently read and be able to talk about that quite confidently in the personal statement. Okay, and then just briefly I'll talk about the actual interview, what you should actually expect on a medical interview. The things that are very important are your appearance, so make sure that you're dressed in a good way for your interview. You should also have a good attitude. As I mentioned before, talk about why you want to be a doctor, but give a good, honest reason. Don't say something like, I want to be a doctor because I get to make lots of money. They want to hear your own passion behind why you want to be a doctor. So that passion and motivation has to come across. Also talk about what you've learned from your experience, and then just display your knowledge. So again, it's like the personal statement, but just having the confidence to do that in the first person when you're actually talking to someone in an interview. Okay, and this just gives you some background on some of the top ranking universities for medicine. This is from 2014, but it hasn't changed too much since then. So Oxford is number 1, then you have Cambridge, Edinburgh, UCL, Aberdeen. So this just gives you an idea of the top 20 medical faculties within the UK. And one other very important point is that when you actually do apply, you should apply to obviously 5 universities. You get 5 choices in UCAS, but you should apply to 4 for the actual medical degree, for the MBBS, and 1 should be a non-medical choice, just to make sure you're covering yourself. And this is often biomedical sciences or pharmacy. But if you want, it could be something completely unrelated. But it's important that you don't make the mistake of making all 5 of your choices for a medical degree, a degree at an MBBS, just in case you're not successful. Now, what I want to talk about just finally is, let's say you're not successful. Let's say you don't get into medical school the first time. I want to make the point that it's not the end of the world. There are alternatives if students are unsuccessful at first at getting into medical school. So normally what can happen is it's actually possible for somebody to become a doctor by studying as a graduate student. So if a student doesn't get into the MBBS that I mentioned, then they can actually study biomedical science for 3 years and then try and go for graduate entry into medical school. This does mean that it's slightly longer though, that's something to take into account. So a typical medical degree I mentioned is 5 years. So if you do the undergraduate degree in biomedical sciences, and then you do a master's, a postgraduate degree rather, in medicine, then that will take you another 4 years after the 3-year undergraduate degree. So it's 7 years in total rather than 5 years. So you do have to study an extra 2 years if you do go into medicine via the postgraduate route. And these are just some of the universities that are available that do have a postgraduate route into medicine. So you've got universities like Leicester, Southampton, Bristol, Liverpool, St George's London, Oxford and Cambridge, Swansea, Imperial College. So it is possible if you don't quite get into medical school the first time at undergraduate level. And just finally on this subject, I did mention at the start that foundations are very risky and are often not accepted in terms of getting into medical school, but there are some that are very good. There is one in particular that we actually offer at Bellerbys. We have a partnership with the Royal College of Surgeons in Ireland, so it is possible to actually get into medical school via that way too if you're unsuccessful with an A-level programme. So that's really all I had to say. I hope that gave you a good understanding of what it's like to get into medical school in the UK, what you need to do. And I open up the floor now for any questions that you guys would like to ask me. Okay, well, thank you very much for your time. I'll make sure I'll share this presentation, so if any of you want a copy, I can make sure that you do receive that. If you do have any other questions that you'd like to ask me, maybe outside the room, I'll be back up on the Bellerbys College stall, so feel free to come and talk to me. Okay, thank you.